How to protect yourself from coronavirus in healthcare facilities. Individuals with respiratory symptoms should wear a medical mask while waiting in triage or waiting areas or during transportation within the facility. Wear a medical mask when staying in areas dedicated to suspected or confirmed cases. Do not wear a medical mask when isolated in single rooms, but cover mouth and nose when coughing or sneezing with disposable paper tissues. Dispose the tissues appropriately and perform hand hygiene immediately afterward. Healthcare workers should wear a medical mask when entering a room where patients suspected or confirmed of being infected with 2019 nCoV are admitted, and in any situation of care provided to a suspected or confirmed case. Use a particulate respirator at least as protective as a U.S. National Institute for Occupational Safety and Health (NIOSH) certified N95, European Union (EU) standard FFP2, or equivalent when performing aerosol-generating procedures such as tracheal intubation, non-invasive ventilation, tracheotomy, cardiopulmonary resuscitation, manual ventilation before intubation, and bronchoscopy. This video aims to provide rapid advice on the use of medical masks in communities, at home and at healthcare facilities in areas that have reported outbreaks caused by the 2019 novel coronavirus 2019 nCoV. It is intended for public health and infection prevention and control (IPC) professionals, healthcare managers, healthcare workers, and community health workers. It will be revised as more data become available. With the current information available, it is suggested that the route of human-to-human transmission of 2019 nCoV is either via respiratory droplets or contact. Any person who is in close contact, within 1 meter, with someone who has respiratory symptoms, e.g., sneezing, coughing, etc., is at risk of being exposed to potentially infective respiratory droplets. Medical masks are surgical or procedure masks that are flat or pleated. Some are like cups, they are affixed to the head with straps. In general, wearing a medical mask is one of the prevention measures to limit the spread of certain respiratory diseases, including 2019 nCoV, in affected areas. However, the use of a mask alone is insufficient to provide an adequate level of protection, and other equally relevant measures should be adopted. If masks are to be used, this measure must be combined with hand hygiene and other IPC measures to prevent the human-to-human transmission of 2019 now. The World Health Organization has developed guidance for home care and health care settings on infection prevention and control (IPC) strategies for use when infection with 2019 nCoV is suspected. Wearing medical masks when not indicated may cause unnecessary cost, procurement burden, and create a false sense of security that can lead to neglecting other essential measures such as hand hygiene practices. Furthermore, using a mask incorrectly may hamper its effectiveness to reduce the risk of transmission.